I could not wait to be here. I am absolutely thrilled about it. This is such an exciting event, and I think anybody that works in hospital work, even the CEO, our whole purpose for being is to make sure that our communities are cared for, and what better place to do it than here at Mission 2010.
I'm hoping to get as many teeth as I can get pulled, because they've gotten so bad up top that it's more of a health issue. It looks, every dentist I go to, I mean, it's $125 per tooth just to get it removed. And then you're looking at, to get everything done, and dentures, you're looking at $5,000 to $7,000, I'm quoting. And when I'm not working, I don't have any money coming in except for $20 here and $40 there. That's just enough to put in a gas tank.
I was kind of overwhelmed at the number of people that really need help. I mean, you see the statistics and all the numbers that come down saying how people are uninsured and they need help, but seeing them in line out here, it's just something else to see how many really need it, and you can count and see the individuals rather than just seeing them as a statistic.
I feel like a throwaway. I worked hard all my life, so very hard. And you can't afford health care, you can't afford dental care. After all this work, I drove tractors for my dad up until I was started school and stuff like that, and then in the evening I worked for him on the farm. And I get sick and I'm not needed, and I can't find nobody to help me.
When I first walked in, the first thing I thought of Katrina, because this facility is actually owned by the city of Greenville, and one of the first events if you want to call it that, was housing Katrina evacuees after the hurricane. But it's really heartwarming to be able to use this facility not only for Katrina evacuees, but also for events like this, where we can partner with so many great organizations and meet a need in the community like we're doing today.
Live at the Carolina First Center in Greenville, where people are lining up for free medical care this morning. I just think the theme is that there's a need. You know, people say, well, what do you do if you're unemployed? How do you get health care? This is unfortunately what you have to do. The nice thing is that there are volunteers out there. There are people who care enough to dedicate their time and donate their services and their expertise for people to be able to be treated.
I almost died of tonsillitis. My hospital bill is $13,000. $13,000? I'll never see $13,000. If it was something realistic, I might be able to afford to pay it. If they sent me a hospital for $600, I'd start sending them $20 a month, whatever I could afford. But $15,000, I honestly can't, and I tell them I honestly can't pay that. But I haven't had to tell anybody that here. I haven't had to tell anybody that I'm unable to afford something.
When you start talking about health issues, which we debate all the time, it's great to see something in motion providing to those who otherwise would not have access, to see that in motion and actually see the rubber meet the road.
You know, people wait in line to get an iPod or a telephone or something. I don't have any of that stuff. I can't afford that. I'm on disability. I needed medical help, and this was a godsend for me. I can't thank all the doctors and nurses and the volunteers who've put their time out here to help the people of the surrounding counties and areas who need this help.
I've had goosebumps the entire morning. What's so cool about it is that people are stopping and saying, this is the most incredible experience, thank you. I've talked to so many people that have lost their jobs, that are uninsured, and they're so thankful and they feel so blessed that this is here today. And so from my perspective, we are truly, truly helping the communities in the upstate, and it's a remarkable experience.
You know, this has been fun. I think the staff is having fun and the patients are wonderful. They're so grateful. I mean, they've waited hours and hours to see us, and they're just, it's been a pleasure.
I hope this happens again before a year. Because hopefully I'll have a job by then, but you know, medical insurance is so expensive. It's, you know, even if you're trying to pay for it on your own, you just can't. It's cost too much money. You just can't do it. And to know that I can get my medicine at least for 6 months without having to pay is a big burden off of me and my husband, both of us.